You've probably heard of keyhole surgery, right? It's one of those marvels of modern medicine. Tiny little incisions, a super fast recovery, way less pain. I mean, on the surface, it seems so gentle. But what's really going on behind those small cuts is a hidden physiological battlefield. Today, we're going to dive into the incredible anesthetic challenges that turn this seemingly simple procedure into a massive stress test for the human body. So this is the big question, the paradox we're tackling. How on earth can a surgery that's designed to be minimally invasive on the outside cause such an absolute storm on the inside? Well, the answer is in what the surgeon has to do to actually see and work inside the abdomen, a process that completely flips the body's normal balanced state on its head. To really get a handle on this, let's make it personal. We're going to follow the journey of a patient. Let's call her Mrs. Sunita. She's 42, and she's coming in for a routine laparoscopic gallbladder removal. Her experience is going to be our roadmap for understanding the incredibly complex dance that happens inside the body during every single one of these surgeries. Mrs. Sunita's journey, and really the heart of this whole thing, boils down to what we can call the 3 trespasses. These are 3 major violations against the body's natural balance, its homeostasis. It's the unique combination of a specific gas, a whole lot of internal pressure, and a very particular body position that creates this massive challenge. So let's break them down, one by one. First up, the gas. You see, for the surgeon to do anything, they need space. They can't work in a collapsed area. This space is created by something called pneumoperitoneum. Honestly, the easiest way to think about it is like they're inflating a balloon inside the abdomen. A gas is gently pumped in to lift the abdominal wall up and away from the organs, creating this nice, clear, dome-shaped workspace. Now you might be thinking, any gas will do, right? Well, not exactly. The choice of gas is actually super important. While you could technically use other things, the hands-down winner is always carbon dioxide. And the reason why is all about safety. CO2 dissolves in blood incredibly easily. So if a little gas bubble accidentally gets into a blood vessel, which is rare but really dangerous, CO2 will just dissolve away harmlessly. Another gas, like helium, it wouldn't dissolve, and it could form a deadly blockage, what we call an embolism. All right, trespass number 2 is pressure. That workspace we just talked about isn't just floating there. It's held open by a constant pressure, usually around 12 to 14 millimeters of mercury. Now that pressure squeezes everything, the intestines, the kidneys, but most importantly, it squeezes the huge blood vessels running through the abdomen, like the inferior vena cava, which is the main highway for blood returning to the heart. And finally, the third trespass, position. For Mrs. Sunita's gallbladder surgery, which is in the upper abdomen, she'll be tilted into a head-up, feet-down position. We call it the reverse Trendelenburg. It's a really clever move because it uses gravity to pull all the other organs down and out of the surgeon's way. But it also causes blood to pull down in the legs, which makes it even tougher for that blood to get back up to the heart. Okay, so let's recap. We've got gas being absorbed into the body, intense internal pressure squishing everything, and a steep body tilt working against blood flow. You put those 3 things together, and what you get is a full-blown physiological storm. Now let's look at how this storm really batters the 2 systems that get hit the hardest, the heart and the lungs. This really shows you the absolute conflict the body is in. On the heart side of things, the pressure is squeezing all the blood vessels, which makes the heart have to work way, way harder to pump blood out. But at the exact same time, the amount of blood coming back to the heart is being choked off. And for the lungs, that pressure pushes the diaphragm way up into the chest, literally squashing the lungs. It reduces their size and makes them stiff and really hard to inflate with each breath. And we are not talking about a small effect here. This is huge. The amount of air left in the lungs after a normal exhale, that can drop by 40%. And lung compliance, that's just the lungs' ability to stretch, can be cut in half. Seriously, just imagine trying to take a deep breath with a heavy weight sitting on your chest. That is basically what the anesthesia machine is fighting against the entire time. So because the lungs are being squashed and they're stiff, the ventilator, the breathing machine, might have to push up to 50% harder just to get a normal-sized breath in. This means the anesthesia team is on their toes, constantly fine-tuning the settings to make sure the patient is getting enough oxygen without causing damage to lungs that are already under so much pressure. Now, the heart's reaction to all of this is, well, it's kind of weird. It's a 2-phase thing. Right at the beginning, when the gas first goes in, it squeezes a bunch of blood out of the big abdominal organs and shunts it back to the heart. This actually causes a short-lived increase in how much blood the heart is pumping. But as that pressure stays on, it starts to crush that inferior vena cava, cutting off the blood supply back to the heart. and that causes cardiac output to drop, sometimes by a whole lot. Now, look, most of the time, the body, with a lot of help from the anesthesia team, handles all this stress just fine. But every now and then, things can go wrong, and they can go wrong very, very fast. This is where the anesthesiologist really earns their pay, acting like an expert pilot who's navigating turbulence, ready for a crisis at any second. So here are 3 of the big ones, the critical complications that, thankfully, are pretty rare. Gas can leak out under the skin, which feels like a strange crackling, kind of like Rice Krispies. More seriously, that gas can track up into the chest and actually collapse a lung. But the one everyone truly fears is when that gas bubble gets directly into a blood vessel, causing a life-threatening gas embolism. If a gas embolism happens, it is an all-hands-on-deck emergency. The response has to be instant and perfectly coordinated. You yell at the surgeon to stop pumping in gas. The abdomen is immediately deflated. The patient gets pure 100% oxygen. They're often tilted in a specific way to try and trap that gas bubble so it doesn't block blood from leaving the heart, all while a massive resuscitation effort kicks off. It's a real testament to the vigilance that's required every single minute. So, after hearing about all of this physiological chaos, you might be sitting there wondering, why in the world do we do this? Why put the body through all that turbulence? And the answer is actually really simple, because the payoff, what the patient gets on the other side, is absolutely enormous. And this right here is the solution to our paradox. Despite all of that intense stress during the operation, the benefits after the operation are just undeniable. Patients have way less pain. They have tiny scars, they go home from the hospital sooner, and they get back to their normal lives so much faster. And here's the really ironic part. Their breathing is actually better after this surgery compared to a big open one because they aren't in agony from a giant incision across their belly. And this analogy just nails it. This is the role of the modern anesthesiologist. They aren't just there to put you to sleep. They are expert pilots, actively managing gas pressures, fluid levels, and blood flow, constantly watching for turbulence and guiding the patient's body safely through that storm to a smooth, safe landing in the recovery room. Which leaves us with one last thing to think about. As our surgeons get even more advanced with their techniques, we're talking robots, even smaller instruments, that paradox just gets deeper. The less the surgeon has to physically cut, the more the anesthesiologist might have to manage on the inside. It's a pretty fascinating frontier in medicine where the whole idea of minimally invasive really truly depends on your point of view.